Hello everyone. Today we are going to discuss an important topic in microbiology and healthcare practice, biomedical waste management and why it matters for safety. This is not just a theoretical concept. It directly affects patient safety, healthcare workers, facility compliance, and the environment when handled incorrectly. Have you ever wondered what happens to the waste generated in hospitals after it is discarded? In this training, we'll explain the full journey. We will be systematic. Define biomedical waste, show types and percentage breakdowns, highlight risks, and walk through step-by-step disposal practices you must follow. By the end, you will know safe segregation procedures, required PEE, and correct disposal steps to protect yourself, patients, colleagues, and the broader community. To begin with, biomedical waste, often abbreviated BMW, refers to any waste generated during diagnosis, treatment, immunization, or related research activities. This includes solid and liquid wastes, contaminated materials, biological byproducts, and sharps like needles and scalpels that can pose infection risks. Sharps, contaminated containers, cultures, and pathological waste are covered under BMW. Proper handling and labeling separates dangerous items from ordinary waste at source. An important point to note is that not all hospital waste is dangerous. In fact, about 80 to 90% of healthcare waste is general waste. Examples of general waste include paper, food remnants, and packaging. These do not require special treatment, but must be kept separate from BMW streams. Only the remaining fraction is potentially infectious or hazardous. That fraction requires segregation, containment, tracking, and documented disposal pathways in practice. Let's review the main categories: general waste, infectious waste, pathological sharps, chemical and pharmaceutical waste, radioactive material, and pressurized containers. On-screen infographic, a pie chart shows roughly 80 to 90% general waste, with the remaining small slices for infectious, sharps, and hazardous streams. Infectious waste includes items contaminated with blood or bodily fluids, cultures, and materials from isolation rooms or diagnostic labs requiring special treatment. Sharps waste includes needles, syringes, scalpels, and broken glass. These require puncture-proof containers and consistent handling at the point of care. Chemical and pharmaceutical waste covers unused drugs, disinfectants, and lab reagents. They demand separate collection and specialist disposal or neutralization methods. Understanding these categories helps staff minimize hazardous volumes and ensures only the necessary portion of waste enters hazardous treatment streams, reducing cost and risk. Improper handling increases infection risk to staff, patients, waste handlers, and the public, and can lead to regulatory fines and environmental contamination. Follow local regulations and facility policies. These documents outline classification, labeling, storage time limits, approved transport routes, and permitted disposal options. Use appropriate personal protective equipment: gloves, gowns, eye protection, and masks whenever handling or transporting biomedical waste to minimize exposure. Always segregate at source using color-coded bins and labeled containers. Never overfill bins or transfer contaminated items into general waste streams. For sharps, always use a rigid puncture-proof container located at the point of use and seal it when approximately 3/4 full to prevent injuries. Maintain clear documentation. Waste logs, transfer manifests, and incident reports help trace issues, support audits, and demonstrate compliance with regulatory requirements. Step 1. Identify and segregate waste at point of care into designated bins using color codes and clear labeling immediately after generation. Step 2. Package and contain waste securely. Liquid waste needs leak-proof containers. Sharps must go into puncture-resistant boxes with tamper-evident lids. Step 3. Label and store waste in secure, ventilated holding areas with restricted access and appropriate temperature control when required by policy. Step 4. Choose approved treatment, autoclaving for infectious material, incineration for certain pathological waste where permitted, chemical treatment for some liquids. Step 5. Arrange transport with licensed waste handlers. Ensure manifests are complete, chain of custody is documented, and handlers follow approved protocols. Closing. Remember that correct biomedical waste management protects people and the planet. Stay informed, follow policy, ask questions, and prioritize safety every single shift. And that wraps up today's topic. If this explanation helped you understand the concept more clearly, make sure to like the video and subscribe to this channel for more simplified lab technology and radiology lessons powered by AI. We break down complex subjects in hematology, biochemistry, microbiology, pathology, X-ray, MRI, and diagnostic imaging, step by step, so you don't just memorize, you truly understand. If you have any questions or want a specific topic covered, drop it in the comments below. Until the next video, keep learning smart, keep thinking critically, and keep mastering diagnostics.